sir, I'm sorry. Don't you think we ought to put people in jail for cheating?
Senator, I do not believe states are cheating.
You don't believe they're
I do
cheating?
not believe
All
that.
right. If they were cheating, what planet did you just parachute in from? Sir?
Sir,
You don't
I've worked
believe
on
states
this.
are
I've
cheating?
worked on this program for a long.
Welcome back to Freedom Forge, where we stand for faith, freedom, personal responsibility, and the constitutional principles that made America the greatest nation on earth. If you believe in honest government, accountability, and protecting hardworking taxpayers, make sure you hit that like button, subscribe to the channel, and turn on notifications so you never miss our coverage of the biggest political hearings happening in Washington. Today's Senate hearing focused on one of the most expensive and controversial government programs in America, Medicaid. Senator John Kennedy questioned witnesses about whether the current Medicaid funding system actually encourages states to abuse federal taxpayer dollars. The hearing centered on the differences between traditional Medicaid and Medicaid expansion under the Affordable Care Act, the possibility of improper enrollment, the billions of dollars taxpayers may be losing every year, and whether anyone is ever held accountable when federal money is improperly spent. What followed was one of the most heated exchanges you'll see in Congress, with Senator Kennedy using his trademark sarcasm while challenging witnesses over allegations of fraud, waste, and government oversight.
Dr. Blaze, before President Obama expanded Medicaid to include able-bodied working adults, traditional Medicaid covered the poor, pregnant women, people with disabilities. Is that correct?
That's correct, Senator.
And today those people are still covered, are they not?
Correct.
And is it not the case that for those folks in traditional Medicaid, for every $1 that, this is an average, for every $1 that a state puts up, the federal government puts up $1.33. Does that sound about right?
That's average across the country, Senator.
All right, now President Obama, through Obamacare, extended Medicaid to able-bodied working adults. Is that correct?
Correct.
And the on average, the federal government for those, I'll call them Obamacare, Medicaid, expansion enrollees, for every $1 that the state puts up, the federal government puts up $9. Is that correct?
That's correct.
Okay. So if you're a governor for traditional Medicaid, you can get $1.33. For Obamacare expansion enrollees, you can get $9.
That's the math that they face.
Right. Now, if you're a governor, you're going to try to get as many people on Medicaid through Obamacare expansion, are you not?
That is the incentive that states have, Senator, yes.
Do some governors cheat?
There are definitely some states that have a massive problem of improper enrollment. So people who would be...
Do some states cheat?
Yes.
Okay.
Many states cheat.
Now, the states determine, in accordance with federal rules, who's eligible for Medicare. Is that for Medicaid? Is that the case?
Yes.
Okay. Now they have to do it in compliance with federal rules, right?
There's the federal eligibility rules that the federal government does a very poor job of enforcing.
Do all states follow the federal rules?
No, they don't.
Some of them cheat, don't they?
Many of them cheat.
Right. Do some states just accept people's word that they make a certain amount of money and therefore qualify for Medicaid?
Yes, Senator.
Do all states say, listen, we hear you and we're not saying you're lying, but we're going to cross-check your application with our state income tax records? Do all states do that?
Not all states do that.
Okay. If they did, they would find out that some people are lying, wouldn't they?
They would.
Now, what's your best guess as to how much per year this cheating costs the federal taxpayer?
We released the report on this yesterday, Senator, and estimated that it's $33 billion. It was $33 billion in 2024.
Okay. And that's $33 billion that is taken away from the people who really need Medicaid. Is that right?
Yes.
Okay. Has anybody gone to jail for doing this?
Not to my knowledge.
Don't you think we ought to start putting people in jail for cheating?
I think that it's financial fraud against the federal government, yes.
Sir, on the end, I'm sorry, I can't read your name. Sir, I'm sorry. Don't you think we ought to put people in jail for cheating?
Senator, I do not believe states are cheating.
You don't believe they're
I
cheating?
do not believe
All right.
that.
If they were cheating, what planet did you just parachute in from? Sir?
Sir,
You don't
I've worked
believe
on
states
this.
are
I've
cheating?
worked on this program for a long time.
But I'm going to be
It's
sure I
not
understand.
perfect,
You don't
but
believe
states do not
You don't
cheat.
believe states are cheating?
I do not believe states are
Do you
cheating.
believe in the tooth fairy? Sir? Do you believe in the Easter Bunny? Do you believe that Jimmy Hoffa died of natural causes? You're not answering.
I do not believe states are cheating in their administration of the Medicaid program.
Okay. I'm glad you have some water in front of you because your pants are on fire. I'm going to go back to Dr. Blaze. Tell me in the 13 seconds I have left, other than putting these people in jail, both the people who cheat and the bureaucrats who allow them to cheat, how else you would fix Medicaid?
So the key problem with Medicaid is that the more states spend, the more money they get from the federal government. So to set the certain amount that states get, and all state spending on top of that comes from the state, that would be an ideal reform. But I'd say a first order reform is to end the discrimination against the most vulnerable. There shouldn't be the federal government incentivizing states with 7 times more money for the able-bodied than traditional enrollees.
Sir, to the gentleman on the end, I don't mean to be rude to you, but if you really believe there's no cheating, you need to put down the bong. That's one of the most extraordinary statements I've ever heard a witness make.
Okay.
Thank you, Mr. Chairman.
Watching this hearing, one thing became very clear to me. Whether you agree with every number presented or not, Americans deserve a government that spends their tax dollars responsibly. Every dollar Washington spends comes from someone who worked hard to earn it. That is not a Republican issue or a Democrat issue. That should be an American principle. One of the biggest moments came when Senator Kennedy asked Dr. Blaze to explain the difference between traditional Medicaid and the Medicaid expansion created under Obamacare. Traditional Medicaid was originally designed to help specific groups of vulnerable Americans, including low-income families, pregnant women, children, seniors, and people living with disabilities. According to the discussion during the hearing, for every $1 a state spends on these traditional beneficiaries, the federal government contributes approximately $1.33 on average. Then Kennedy turned to Medicaid expansion. Under the Affordable Care Act, many states expanded Medicaid eligibility to include more able-bodied adults who previously would not have qualified. According to the testimony presented during the hearing, for every $1 those states spend on expansion enrollees, the federal government contributes roughly $9. Now, whether you support Medicaid expansion or oppose it, that funding difference is significant. Senator Kennedy argued that such a large disparity creates a financial incentive for states to prioritize expansion enrollment because the federal government shoulders a much larger share of the cost. His point was straightforward. If one government program gives you a federal match of roughly $1 and another gives you around $9, which one do you think state governments will naturally favor? That was the central argument Kennedy was making throughout his questioning. As someone who believes in limited government and responsible budgeting, I think incentives matter. Government programs should be designed to encourage honesty efficiency, and accountability, not create situations where states may be tempted to maximize federal dollars simply because the reimbursement formula makes it financially attractive. The hearing then became even more intense. Senator Kennedy asked whether states always follow federal Medicaid eligibility rules. Dr. Blaze answered that, in his view, not all states comply with those rules, and that some have significant problems with improper enrollment. Kennedy repeatedly used the word cheat, asking directly whether some states cheat. Dr. Blaze responded that many states have serious issues with improper enrollment. One example discussed during the hearing involved income verification. According to the testimony, some states rely heavily on applicants' self-reported income instead of consistently cross-checking those claims against available tax records or other verification systems. Kennedy argued that if states fail to verify income properly, some ineligible individuals may end up receiving benefits that were intended for people who truly qualify. That brings us to another major claim made during the hearing. Dr. Blaze referenced a report estimating that improper Medicaid enrollment cost federal taxpayers approximately $33 billion during 2024. Now, it's important to recognize that estimates like this depend on the methodology used in the report, and debates often continue over the precise size and causes of improper payments. But regardless of the exact figure, improper payments in federal programs have been a long-standing concern identified by multiple government oversight agencies. And here's where I think the conversation becomes even more important. Every dollar that goes to someone who isn't eligible is a dollar that isn't available for someone who genuinely needs medical care. That isn't just about balancing a budget. It's about protecting the integrity of programs that millions of vulnerable Americans rely on. Waste hurts everyone. Taxpayers lose. Legitimate beneficiaries lose. Public confidence in government declines. Nobody wins when government fails to safeguard public money. Then came one of the most memorable exchanges of the hearing. Kennedy asked whether anyone had gone to jail over this kind of Medicaid fraud. Dr. Blaze said that, to his knowledge, no one had. Kennedy responded by suggesting that people who intentionally commit financial fraud against the federal government should face criminal prosecution. That is a serious statement, and it's one that raises broader questions about enforcement. If laws exist but are never enforced, do they actually deter misconduct? Accountability has to mean something. The hearing then took an unexpected turn. Kennedy questioned another witness who disagreed with the characterization that states were cheating in administering Medicaid. That disagreement immediately sparked a tense exchange. Kennedy challenged the witness with a series of sarcastic remarks, comparing the denial to believing in the Tooth Fairy, the Easter Bunny, and suggesting disbelief over historical mysteries. He ultimately accused the witness of refusing to acknowledge reality and closed the exchange by saying the witness's statement was one of the most extraordinary claims he had ever heard during a hearing. Love him or hate him, Senator Kennedy has a communication style that definitely grabs attention. He mixes humor with sharp criticism, and supporters often argue that he says what many taxpayers are already thinking. Critics, of course, argue that his style can sometimes overshadow complex policy discussions. Regardless of where you stand politically, there's no denying that exchanges like this generate public attention because they force difficult questions into the spotlight. One thing I think conservatives have been saying for years is that government programs need stronger oversight. That doesn't mean eliminating help for vulnerable Americans. Far from it. If anything, protecting Medicaid requires making sure the program actually serves those it was created to help. A safety net only works if people trust that it is being administered fairly. If Americans begin believing that waste, fraud, and improper payments are tolerated, public confidence in the entire system erodes. Another point raised during the hearing involved structural reform. Dr. Blaze suggested changing the federal funding model so states would receive a more predictable amount of federal support rather than continuously receiving additional matching funds based on spending levels. He also argued that the current funding disparity between traditional Medicaid beneficiaries and expansion enrollees should be addressed. Whether Congress ultimately adopts those ideas is a matter for lawmakers to debate. Supporters may argue such reforms would encourage greater fiscal discipline and reduce incentives for overspending. Opponents may argue they could affect state budgets or healthcare access. Those policy debates deserve careful examination based on evidence and data. But one principle should unite everyone regardless of political affiliation. Government should always strive to ensure taxpayer dollars are spent lawfully, transparently, and efficiently. As conservatives, we often talk about personal responsibility. The same standard should apply to government. If families have to balance their budgets, if small businesses have to account for every dollar, if workers have to pay their taxes honestly, then government should be held to that same level of accountability. No exceptions. This hearing also reminds us why congressional oversight matters. Without hearings like this, many Americans might never hear questions about how federal dollars are being spent or whether existing safeguards are working as intended. Oversight is one of Congress's constitutional responsibilities. Whether those hearings expose waste, identify weaknesses in federal programs, or simply encourage greater transparency, they play an important role in democratic accountability. At the end of the day, this hearing wasn't just about Medicaid. It was about trust. Can Americans trust that government programs are being managed responsibly? Can taxpayers trust that their money is being protected? Can vulnerable citizens trust that resources intended for them will actually be available when they need them? Those are questions every administration and every Congress should be willing to answer. If there's one lesson to take away from today's hearing, it's that transparency and accountability should never be partisan values. They should be American values. No matter which party controls Washington, the federal government has a duty to protect taxpayer money, enforce the law fairly, and ensure that public programs fulfill the missions they were created to serve. What do you think? Did Senator Kennedy raise legitimate concerns about incentives, oversight, and accountability in Medicaid? Or do you think the problems discussed during the hearing were overstated? Let us know your thoughts in the comments below. Healthy debate is always welcome, as long as we keep it respectful and focused on the facts. If you enjoyed this breakdown and want more in-depth coverage of the biggest hearings shaping America's future, don't forget to like this video, subscribe to Freedom Forge, and share this video with friends and family. Thank you for watching, and we'll see you in the next one.